Hi, my name is Elizabeth Conrad, and my emergency management oral presentation is on special need groups and disasters. This is me. Who is considered special needs? American Disability Act, which is the ADA of 1990, states that persons with disabilities are a protected class. Having a record of such an impairment or regard as having such an impairment, the ADA defines disability in specific terms: physical, severe arthritis, spinal cord injuries, people who use wheelchairs, people with multiple sclerosis. They also have sensory issues of the visually impaired, the blind, the deaf, or hard of hearing, or cognitive, which are the people with mental illness, learning disabilities, mental retardation, or even developmental disabilities. These are also some that are considered of special needs. Pregnant women, because during a disaster, they require more food since they are feeding themselves and also the baby in their womb. And they do need medical attention. Babies and young children, because they can't really, they need somebody to help guide them. Elderly people, especially the ones that are living in nursing homes. We have the disabled, non-English speaking people, because when there is a disaster, they don't understand what's really going on. So they do need they do require a little bit more assistance. Also, people who require medical assistance, those who are bound to wheelchairs and need nurses by their side. And people without transportation, even single parents, because if they have small young ones, they will need help with getting them and the children situated. The National Response Framework definition for special needs provides a function-based approach for planning and seeks to establish a flexible framework that addresses a broad set of common function-based needs of different diagnoses or statuses and different labels of children and of adults. Governments that choose to align their language to the National Response Framework will improve intergovernmental communication during an incident. Populations whose members may have additional needs before, during, or after an incident in functional areas, including but not included to maintaining independence, communication, transportation, supervision, and medical care. According to the NRF, maintaining independence are individuals required support to be independent in daily activities that lose this support during the course of an emergency or disaster. These include, children who require diapers and formula, people who need catheters, people who are in wheelchairs, whether they're adults or children, walkers and scooters, different caregivers for the people who are, bound to wheelchairs and who need extra assistance. Supplying needed support to these individuals would enable them to maintain their pre-disaster level of independence. Communications, individuals who have limitations that interfere with the receipt of response to information that will need the information provided in methods which they can understand and use. This would also go for non-English speaking people, or people who are hard of hearing, who have vision impairments. Those are some that are limited to this. Transportation, individuals who cannot drive or do not have a wheelchair may require transportation. This includes like lift equipped or vehicles suitable for transporting individuals who use oxygen, or even some who are bound to wheelchairs. Supervision, before, during, or after an emergency, individuals may lose the support of caregivers, family of friends, or may have been unable to cope in a new environment. This can be for dementia type patients, schizophrenia or people who have high anxiety. If separated from their caregivers, young children may be unable to identify with themselves, and one danger is really occurring. Medical care. These are individuals who are self-sufficient or do not have adequate support from caregivers, family, or friends that need assistance maintaining. These individuals also require the support of trained medical professionals. whether they need a feeding tube, they have, or need daily dialysis or oxygen. They need somebody to help them out with these things. Partnerships. This also allows government agencies and community organizations to be able to give assistance and aid what is happening, as well as keep their weaknesses in areas of improvement in order. These all occur at the stages of mitigation and preparedness, during a response, and also during the recovery.